The NHS is going through one of the most difficult times in history at the moment, and staff are leaving in the masses. In this video, I kind of wanted to go through what's happening and whether I still think it was worth it being a GP trainee, almost ready to qualify and be a junior doctor no longer, having worked in the NHS for my whole career. The reason why I want to make this video is basically to help the general public understand what we're going through, as well as anyone who is thinking about starting a career in medicine, and helping you to make a decision on whether it would be the right thing for you. So recently, doctor striking has been in the news a lot, and part of the reason why is that pay and conditions have deteriorated significantly. I was speaking to one of the partners in my local area recently, and he was talking about how, as a doctor around just 15 years ago when he first qualified in a GP practice, he would be able to do a morning clinic and then go home for about 4 hours. Okay, so he would work for 2 or 3 hours in the morning, and then he would have a lot of time off to spend time with the family, go to the gym, cook some lunch, and just do a lot of self-care measures that make life meaningful. He would go back in the afternoon, do a 2-hour clinic again, and then it would be back home again. Now, those days are gone. GPs are staying later and later, 6, 7 p.m. And starting at 8. So, and that's the speciality that's supposed to have the best work-life balance, whatever that is. And I think we think that it's work-life balance because, we don't have to do weekends and night shifts and evenings, but you seem to be compensating for that with like an extremely intense workload whilst you're actually at work. So if you're thinking about medicine in the UK, you're probably not looking at GP immediately right from the beginning. You're probably looking at hospitals and internal medicine and doing your rotations as junior doctors. How is foundation training now? Honestly, it's tough. It's tough. I think if you look at the satisfaction levels of doctors throughout their training, it's actually at its lowest in the first 2 years of training, and then it goes up slightly thereafter, rising as people get towards the end of the training to my level. Looking back at those years, I learned so much, and I feel like I actually made a real difference to patients and their lives, and it was amazing being seen as a doctor finally after being a medical student for so long. But even though I'm usually an optimist, I have to say that there were a lot of drawbacks. Lack of supervision, really difficult night shifts, being bleeped by 6 different people at once for ill patients and not knowing which one to actually go and help during that time. And these are the kind of decisions where you leave your shift and you're still thinking about whether you help that patient, and that's even coming from someone who's usually quite a relaxed person. So now, are things better than they were during my F1, F2 years? I would say definitely. I have a better work-life balance usually. I leave around 5 and start at between 8 and 9, depending on what day it is. And I have a good team around me. The practice I'm working in cares quite a lot about us, and there's short training to get into GP training. I've got a child on the way. I think I've got time to be able to, commit to family, and run this YouTube channel as well. So, those are all big pluses. Pay, to be honest, I think if you're going to live in London, you need to be supplementing through some other means. If you're going to be renting privately, you need to either have rich parents or create some kind of a side hustle, where you can make money, I don't know, selling lights on Amazon, or you like creating your own YouTube channel, or property, whatever you choose to do. I think it's very difficult to pay London rent and survive off a junior doctor's salary. Junior doctors have gotten a pay cut of around 30% in the last 20 years. If you look at this graph, you can see that it kept up the least with inflation compared to other public sector workers, and that's really part of the reason why strike is necessary. So, I've talked a little bit about the problems, my experiences, what things are like, and now it comes back to this question, like, was it all worth it? And it's so difficult to answer that question. There's so many different things to consider. Would I do it again, or knowing all that I know now? That's really, really tough question. I would honestly say probably not. Knowing all I've done now, would I do it again? I don't think so. I feel like there are other careers out there which have, still satisfying work-life balance, and you can make an impact in the environment and things, while making more money and preserving your kind of health and well-being. But do I enjoy my job now? Absolutely yes. Do I enjoy medicine as a science and as a field? Yes. Do I enjoy treating patients? For the most part, yes. And so it's a tough balance between them. And I think ultimately I've done a lot of thinking, and the mental models that I have around this to be able to help you decide whether you want to actually go ahead with a career in medicine are as follows. I think that you should do medicine if you are keen to do it, unless one of these three things applies. Okay, so this is generally, I think, across the whole world, but especially in the UK with the political situation as it is now, these three things I think would stop you from applying to medicine, and those are: if you have a personality that's high in neuroticism, is number one. I think these types of people make actually some of the best doctors. If you're always worried about having missed something, then you tend to think about things a little bit longer, and generally are less likely to miss things, but at the expense of doing more investigations and of your kind of mental well-being. Once you get home, you'll still be thinking about work. The second person that I wouldn't recommend it to is if you want to make money, like a good amount of money. If you want to be a millionaire, you want to be able to buy your own house, be secure, send your kids to nursery, private school, and have a very comfortable life, buy an Aston Martin or a Tesla. I think medicine is not for you. I think that it would take a very long time to be able to make enough money to have that comfort. I think for the generations above us, it was a lot easier, and we talk about this during my training program a lot. We have these kinds of discussions, and if I'm honest with you, the vast majority of the GP trainees are trying to leave at the first opportunity that they can get by creating some kind of enterprise to help them on their way to become entrepreneurs. And they're very smart, talented people, and it is a little bit of a shame that all of this talent isn't being put into the system to be able to try and encourage new solutions that help the NHS run quicker and more efficiently, because there are a lot of inefficiencies there. But that is actually a pro that, if you are looking to innovate, there is opportunity to do that. And there are now NHS schemes that will invest to be able to support doctors to fix problems, although some of them are quite difficult to access and do take a long time, but they are there, which is, it's amazing. to see that progression move along. I mean, I did an academic foundation program in leadership and management, in my elder sister's years, which were around, 7 or 8 years before I graduated. That was unheard of. No one would ever think that they would give you 4 months to, study a university course in leadership and management and do a project. And I got published in the BMJ Leader journal after that from my project, and things are moving in the right direction. So you're probably interested to hear what the third thing is that you should not do medicine, and that is if you want a flexible life. Medicine is not flexible, especially in the first minimum 5 years, and probably longer than that. You need a significant commitment, and your time will be out of your hands. You can do less than full-time training, although that really extends the pain for quite a long time. And people who have done it have also said that actually sometimes you end up still doing more work, even though you're supposed to be there for a set amount of time. The work finishes when you are done with the work, not when your rota says it's time to leave. So you might end up doing more work by doing the less than full-time option, but that is there. Otherwise, you don't have that flexibility. You have to turn up when you're told to turn up, and yes, there is usually advance notice with that. The rotations are supposed to give you 6 weeks notice, but practically what I found is that it doesn't always happen. Administrative departments are really overstretched at the moment, and when I've tried to do meetups with my friends, there's always at least 2 or 3 people that don't show up, and it's because most of us are doctors and most of us are in training, and trying to get people's rotas to match up is almost impossible. So you will miss social events, you will miss birthdays and anniversaries, hopefully not weddings, because you should be able to give enough notice and enough pull with your colleagues to be able to swap with you for that one. But I do think that does summarize it. Medicine, I think I would end by saying, it's a career that gives intense emotions, swinging from the highest highs to the lowest lows. And the reason why I'm telling you this is because really of an old Roman proverb, and it's praemonitas, which is forewarned is forearmed. I want you to go into the career knowing everything that I wish I would have known before starting, and to be able to make an armed decision because of it. So best of luck, and maybe see you in the clinics one day.